Hello everyone, today I am here to discuss the topic of education and training program in the hospital. In the previous lecture, we have discussed about what are the training programs, how many types of it is, and why it is important in the hospital. So today we will discuss why pharmacists are in the key role for the education and training program, what is the role in the interdepartmental communication, and actually how they are communicating in the community health education. So let's start with one by one. First topic is the code of ethics for community pharmacy. So we'll discuss about the pharmacists and their code of ethics, which is important from the perspective of the community pharmacy. Point number one, a pharmacist should respect the covenantal relationship between the patient and a pharmacist. So there should be the formal relationship maintained between the patient, pharmacist and other healthcare professionals. These healthcare professionals could be, of course, physicians, nurses, lab technicians, whosoever are working in the hospital. Another point, a pharmacist should have, they should promote the good of every patient in respect of the treatment in a caring way, and that's also the important part of the patient counseling. They should be caring, they should compassionate, and they should be whatever the answers they are giving to the patient, it should be in confidential manner. Point number three, a pharmacist should respect the autonomy and dignity of each patient. Whatever the options a patient is selecting, and pharmacist should maintain the confidentiality of each and every statement which is given by the patient, and that's a very important part. What other things a pharmacist should have that we are talking of? Code of ethics means the morals a pharmacist should have. So point number four, a pharmacist should also act with the honesty. Whatever the information a pharmacist give to the patient, it should be with honesty. It should be integrated form. There should not be any biasness in any of the information, not for the sake of any company, not for the sake of any hospital. Point number five, a pharmacist maintain professional competence. How a pharmacist will maintain the professional competence? Of course, by improving their knowledge day by day. They are updating their knowledge. And this is all by the continuous education program, by training program, by research. So they should have the updated information. This is also the part. What other thing a pharmacist should have? A pharmacist respects the values and abilities of colleagues and other healthcare professionals. This is I was talking in previous slides. How a pharmacist should have? They should respect the values and abilities of other healthcare professionals and whosoever are working in the hospital. A pharmacist serves, of course, they are serving the individual means. Here I am talking about a single patient. They are also serving to the community, means the group of the peoples. And also, they are serving to the society. Point number 8, a pharmacist should seek justice in the distribution of health facilities. Here, this point want to say justice in distribution of health facility means the drug should be given on equal basis to the rich as well as poor, no discrimination between races, not on the gender basis. So there should be equity in the distribution of health facility. These all morals a pharmacist should have. Another point or another topic we can say here is the role of pharmacist in the interdepartmental communication. So there are different departments in a single hospital, and a pharmacist has a role in different department. A department could be where the research or clinical trials are performed. So there should be a section for the clinical trials. There should be a nursing stations. There's a pharmacy. There's another administrative department. So there are different departments in the hospital and how the pharmacists are helping in different departments. Here we are going to discuss this point. So see, hospitals can prevent medication errors. This is the main point we want to achieve, to reduce the medication error and improving the treatment. Why to improving the treatment? Of course, to increase the outcomes. Here we want to increase the outcomes. So, for all these points, means to prevent medication errors or to improve treatment strategies or to increase the outcomes, it is very important to work in a team. So, if they encourage, how they are doing it, if they encourage collaboration, what I told you, collaboration between the pharmacy and other staff members, if physicians, nurses, pharmacists all are working in a team, of course, they can achieve these 2-3 goals. Now, department should communicate with pharmacy and nursing staff. What are the conditions? These are some of the examples I have written here. What could be the example? Of course, when a physician will write any medication order, or if patient's age is affected, sometimes what happens, a physician is treating geriatric population or a pediatric population. So these are some of the special cases where the attention is needed. At the time, a physician can take recommendation with a pharmacist, or pharmacist can take a recommendation with a physician. Another point, nurses give out medication for first time. When a nurses are giving, there is a new drug, there is a new type of administration. At that time also collaboration is needed. They all are collaborating, all the healthcare professionals are collaborating, and they are maintaining these all goals. So now the pharmacists in the interdepartmental communication, they are categorized on the basis of different departments. And what are these departments? Let's see, the point number 1, I told you, in the hospital there are different departments. So there is a need of the cooperation with medical research staff. Means where the researches are being performed. So these type of researches means clinical trials. Sometimes there are clinical trials. So in this also the pharmacists have the key role. Pharmacists are the integral part of the clinical research. Same thing I told you. They are controlling the inventory. Means they are maintaining the drug. How much amount should be there and how much is for the consumption, for the procurement, how to select the drug, selection criteria. These all points are covered in controlling the inventory, how to reduce the cost. Pharmacists are doing all this, how to distribute the drug. Yes, maintenance and accurate record on the chemistry, and pharmacists are recording the chemistry, the pharmacology, the dose calculation, the poisonous effects of the compounds. And of course, after noting all these things, they are calculating the outcomes. On the basis of this, it is implemented in any organization or hospital. Suggesting and preparing better vehicles. What could be the better dilution factor or physical forms of any new compound? Any compound can be in the form of capsules we can give, as a solid, tablet we can give. Another could be the syrups, there could be the emulsions, there could be the injections. So these all are the physical forms of the new compound. Then there is the developing and operating of double and triple clinical blind. What happens in the clinical trials? Sometimes there is the changes in the result just because of the psychological changes. There is a bias this. So in the clinical trials, healthcare teams try to achieve or try to reduce the biasness. For that, there is a concept called as a blinding. So in the blinding, what they are trying to do, they are reducing the biasness. There are different methods for the biasness. One is the single blinding, another could be double blinding, another could be triple blinding. In single blinding physician, the patient don't know what patient is getting, what treatment. In double blinding, what happens? Physician as well as patient don't know what is actually the treatment. In triple blinding, what happens? Patient as well as physician as well as whosoever is noting the outcomes, they all don't know whatever the treatment is going on. So, in double and triple blinding, by doing this, what they are trying to achieve is to reduce the biasness. Another, they are assisting the physician in recruiting control groups. Sometimes what happen actually in the clinical trials, there are two type of groups. One is the control group, another is the treatment group. Because there is a comparison between these two groups. For the control groups, the therapy which is used could be the placebo, whereas the treatment group, the therapy which is given, it is having a effect. Means it could be any of the drug A or a drug B, any drug. So it is trying to compare at the last and try to find the results. So in all of these all things, especially in the condition of the medical research staff, pharmacist has a very great role. They are working as a clinical research associate, clinical research. Now, cooperation with the local pharmacists. They have also role in the retailers. With the retailers, how they are communicating with the retailers? Let's see. They are trying to do the financing each other products. They are doing marketing available from the hospital pharmacy. They are doing advertisement. In that way, they are doing financing. So another is the cooperation with the nursing staff. As we have discussed, they have the cooperation with the research team. They have the cooperation with the retailers. Similarly, they have the cooperation with the nursing staff at the nursing stations especially. So, in the hospitals, there are nursing stations. And what they are doing, they are orienting. First point is the giving the training, as this is a part of the education and training. So, they are giving the training to the nurses, they are giving training to the student nurses, the pharmacists, the pharmacy students. Yes, they are the short-term, long-term trainings. These type of trainings are given by the pharmacists. So, they have the role in the education and training program in the cooperation with the nursing staff. Other could be collaboration with nurses. They have the collaboration with nurses and also with the pharmacists in the roles such as patient education. At the time when there is a need of the patient counseling, monitoring adverse effect reactions, adverse drug reactions, ADRs, monitoring, nurse pharmacist rounds, they are the rounds where they are trying to see the critical care areas and nursing care plans. By all this, they are trying to achieve or reduce the medication errors. They are trying to increase the outcome goals for the particular therapy. Now, this is also one part where we are trying to study is the information provided by nurse to nurse by a pharmacist. Whatever the information a pharmacist can provide to the nurse, here we'll see, because a pharmacist is expert in the areas of drug. So, a pharmacist can tell about the investigational drugs, whatever the information a pharmacist is getting from the trials, clinical trials, they are giving to the nurses, they are giving to the other healthcare professionals. Similarly, side effects and therapeutic risk. Whatever the side effects of any drug or a therapeutic risk which is calculated by the therapeutic drug monitoring. There is a concept called therapeutic drug monitoring. I have also discussed in one of the previous PPTs. In chronic cases or where there is a very low therapeutic window, therapeutic drug monitoring is done. So, a pharmacist can tell all these aspects to the nurses. Similarly, if any contraindications are there, like a particular drug is not given in the pregnancy, a particular drug cannot be given in the lactation, a particular drug cannot be given to the geriatric population. So like this, so contraindications, compatibility and compatibility and stability of the drugs. Here, what could be the storage condition? What is the dilution used for any of the formulation? All this information is given by the pharmacist to the nurses. Drug competitions means there is a dosage calculation. So pharmacists are doing the dosage calculations also. Yes? How they are doing the dosage calculation? Of course, by seeing the therapeutic drug monitoring, they are modifying the therapy, they are modifying the dose. So, this is also one of the part a pharmacist is doing, and they are also giving the information to the nurses, to the physician or other healthcare professionals. Similarly, a pharmacist very well know about the drug metabolism, how drug is metabolized. Why this information is needed? That's the question comes to the mind. This information is needed because some patients are liver compromised and some patients are kidney compromised. By the liver, most of the drug is metabolized, whereas for the excretion, most of the drugs are excreted by the kidney. At that time, it is very important to know if a patient is liver compromised or the kidney compromised. So, it is good that a pharmacist are giving the information to the other members. Similarly, what is the pharmacokinetic profile of a drug? Means ADME. A, absorption, D is distribution, and is metabolism, E is excretion. Every aspects of these drugs, this pharmacokinetic profile of a drug, a pharmacist is giving to the nurses. Now there is a drug interaction. Why this information is needed? Just because some patients are with comorbidity. Some patients have one with another diseases. Like a patient is suffering diabetes with a hypertension, a patient is suffering from hypertension with any of the neurological disorders, a patient is suffering. So there are many diseases. For that, a patient is taking many of the drugs. At that time, what happened? There are the chances of the drug interactions, and drug interaction can be many more. So it could be drug-drug interaction, it could be drug-food interaction, it could be drug-herbal interactions. All these interactions the pharmacist can tell to the nurses. Whereas the factors affecting drug actions, there are some of factors which affects the drug action. Means the effects which actually should happen after giving a particular drug therapy, it is not coming because there are many factors. So age could be one of the factors. So yes, I have taken one example here is age. Sometimes in pediatric and geriatric population, what happens? Actually drug action not happens in a way which it should have. So the pharmacist should have all of these information they're trying to give to the nurses. In that way, they are helping in the interdepartmental communication. I hope you are getting the concept of this. Now, they are also helping in the drug information services. We have also discussed in previous PPTs that there is a DIC center. DIC is a Drug Information Center in the hospital. So what happens from there? As the name mentions, Drug Information Center is giving all of the information related with the drug, and they are open for a call 24 hours a day. So any information from pharmacokinetic profile to the poisoning, everything for the treatment management, any of the information can be taken from the DIC. So in the drug information services, the pharmacist has a role. Drug information bulletins and newsletters are also prepared by the pharmacist, and these things have the information. They are the updated information. Every new information is written in the bulletins or the newsletters, and they are of course they could be weekly printed, they could be monthly printed, they could be yearly printed. So like this. Now each nursing unit should be provided with a reference material. These reference materials could be Formulary of India, National Formulary of India. In this, everything, there is a listing of drugs are written in the National Formulary of India, and this is act as a reference material which is provided by the pharmacists to the nursing stations. Pharmacists also participate with nurses and physicians in review of patient medication. So in patient medication, pharmacists are also working. and they are trying to remove the therapeutic duplication. Sometimes what happens, if a patient is suffering from 2 or 3 diseases and there are different drugs, means like I am just giving an example of a painkiller, and I have written 2-3 painkillers with a different brand names, or we can say different generic name, but they all are giving the purpose to reduce the pain. So at that time what happens, there is a therapeutic duplication occurs. So trying to reduce this, and if there is any possible drug interaction, so pharmacists are helping to reduce these drug interactions also. So in drug information services, what happens, the pharmacist is giving every information if any is needed to the whosoever actually needs it. In another way, a pharmacist is also helping in the administrative work. Yes, so as we have discussed, the pharmacist has role in the nursing station, the pharmacist has role with the local pharmacist has a role with the research, pharmacist has a role with the administrative work, like this. Now in the administrative work, hospital pharmacists serving in committees. What are these committees? These committees could be current practice committee, means what drugs actually are in the hospitals, what drugs are used in the hospitals for the treatment. In this committee, they are actually working for it. Safety committee. There is a committee called as infection control committee. Whatever the infections are there, what should be the guidelines, what should be the protocols, how to manage the infection, these all things will be under infection control committee. Where is the antibiotic committee? This is a very important committee. What pharmacists are doing, the main goal is to reduce the resistance. And administrative policy committee. So to make the protocols, guidelines, they are working. And what is we are calling this committee called as a pharmacy and therapeutic committee. It's called as PTC. So they are working as, and they are providing the information to all the committees: current practice committee, safety committee, infection control, and antibiotic committee. Now they have the role in the infection control. We are doing it on a broad basis, how they are working in the infection control. So see, they have a role, like what are the responsibilities here. They are maintaining the records or written standards, they are making protocols, they are making guidelines, that if any bacterial infection, I am taking just an example, any bacterial infection, any viral infection, or any other infection, parasitic infection. So what should be the drugs? And also in the bacterial infection, there are different categories. What should be the drug? The drug A should be given for 5 days, like this, and there should be follow-up. So like this all protocols are prepared by the pharmacist as a team, because the pharmacist, medical staff is working, nursing staff is working, pharmaceutical, microbiological staff is working, other administrative staff is working, and they are making the written standards for hospital sanitation and asepsis, how to reduce the infection. Development of procedures and techniques. What techniques should be used? What sterilization equipment should be used to reduce the infection? Development and implementation of system of routine surveillance. And of course, it is very important to note or to monitor and review. If the infection is not reduced by any of the techniques they are using, of course, it will be changed. There is a need of change. So all these things they are doing in reducing the infection. Another is they all are participating, the pharmacists also participating in continuing education program. This I was telling from the previous of the slides, that pharmacists should have, as it is a part of the code of ethics, they should have the professional competence. How they will maintain the professional competence? So of course only by participating in continual education program. So they are developing more complete understanding of importance and methods of lifelong self-directed education. So to maintain upgradation, and to maintain the update information of the drugs. It's very important to participate in the continuing education program. They are evaluating their professional performance on the basis of very small tests, identify the areas where the improvement is needed and that they are trying to achieve it. Another is the pharmacists also are working in the rehabilitation area. What happens? The patients who are suffering with a drug abuse problems. So, these patients actually revive, pharmacists are trying to revive or restore the lost skills of the patients. In that they are helping, and also to reduce the withdrawal symptoms, because what happens, the substances or the drug abuse substances, they are giving the withdrawal symptoms. So, it's very important at the time to give the counseling session as well as to give the therapies which are trying to reduce the withdrawal symptoms as well. Now, drug abuse problems treated in the hospitals, they are helping in this. Pharmacists, they are seeing the legal and ethical issues involved in treating in drug abuse. Also, I told you, if any therapy is required to treat this drug abuse problems, so medical and psychiatric approaches are used for the treatment of drug abuse. In that psychiatric approaches, what pharmacist is giving? There is a patient counseling. There is a sessions, counseling sessions are there for the treatment of the drug abuse. Now, use of various drugs in the detoxification. Detoxification, for the detoxification purpose, there are some of the antidotes which is given to the patient, and problems associated with it. I told you problems associated with it means the withdrawal symptoms. So, to reduce the withdrawal symptoms, any of the therapy can be given, a psychiatric approaches can be used for treating the patient, and pharmacists are giving a good role in this program. Another is, as we have discussed previously, the pharmacist role in the interdepartmental communication. Here is the role of pharmacist in the community health education. So, CHE, community health education. Now, we'll read this, how they are helping in the in giving the health education to the society. So, the pharmacist services of today's include, where we are talking about the community health education, of course, this is more oriented towards the patient care. So, pharmacists are actually understanding the problems of the patient, what is the issues related with the patient, what is the problem, why the patient is actually not taking the medication, what are the compliance barriers. So, all these points are covered here. The pharmacist services of today's include patient oriented, administrative and public health functions. Here, pharmacist unique expertise. Why? Because they have the knowledge about the drugs, so they are the unique expertise, which includes pharmacotherapy, how therapy should be drawn, access to care, yes, and prevention services. Prevention services means if any disease is to be treated, there are different measures. It could be pharmacological measures, it could be non-pharmacological measures. So, for non-pharmacological measures, what could be the option? Of course, there could be the exercise, there could be the diet control. Yes. So, these patient counseling for any of the disease we call psychiatric problems. So, these all points are covered for the non-pharmacological measures, whereas there is a pharmacological measures as well. So, prevention services, in the prevention service, a pharmacist can give all these type of services. Pharmacists' contribution to the public health workforce in the health education, they are giving the patient counseling, they are helping in the disease prevention. There are some of the levels of prevention of disease, and this is also the part where disease is prevented by many of the methods. Yes, and these methods could be, of course, as I told you before, there could be dietary changes, there could be lifestyle changes, yes. There could be health promotion. So, So these all changes can be done here. And health promotion, similar written here. Health equity means a therapy, if any therapy or any drug is distributed, they should be distributed without any biasness, without any discrimination. Means a rich or poor should have the same health services, and health quality will aid in achieving the optimal public health outcome. So like this, they are providing in the communication in the community health education. Now there are some of the this is all the concrete, we can say the summarized sheet. The summarized sheet is telling the role of pharmacist in the community health education. We have previously discussed what are these roles. They could give the information in like this, the therapy to the patient. Any information, any query a patient should have, the pharmacist provide by the patient counseling. They are improving the quality of life. How? Because some patients are suffering from the chronic illnesses, and that quality of life is very important. They are also doing the disease monitoring. How? Follow-up. By doing the follow-up. They are giving the awareness programs to the patients. Yes? Some of the diseases the patient actually don't know, or the therapy the patient don't know. At the time, the pharmacist providing the information in the awareness program. Similarly, health promotion. How to promote the health? Of course, by changing the dietary intake, by changing the lifestyle, all these factors. Here, they are giving the pharmaceutical care. But how? Of course, the patient to understand properly what is the issues related to the patient, what is the problem the patient should have. They are getting the information and then trying to modify the therapy. Another is the assist healthcare professionals on therapy management. How they are assisting? Of course, to the physicians they are assisting. To the nurses they are assisting, how to administer the drug, which new therapy is there, like this. Then there is a dispensing and distribution of medicines. A medicine should be distributed in an equal manner. There should be the health equity, which we are discussing from the previous of the slides. So this is all about how they are giving the information and they are helping in the community health education. I hope you all got this. So thank you so much. We'll meet in the next session.